Living with chronic inflammation can feel, well, pretty confusing and frustrating, right? So what we're going to do in this explainer is break it all down. What it is, how it's diagnosed, and how you can manage it, using some clear, straightforward slides to help us along the way. Let's dive in.
It's a really good question when you think about it. I mean, our bodies have this amazing defense system, but what happens when that system gets its wires totally crossed? That's the core mystery we're going to unpack together.
All right, first things first. Let's really get to know the main character in this whole story, inflammation itself. What is it really, and how does something that's supposed to help us end up causing such a persistent problem? You know, we've all felt inflammation. Think about it. You get a little cut on your finger. What happens? It gets red, warm, maybe a bit swollen. And that's actually a good thing. That's your immune system rushing to the scene, cleaning things up and kicking off the healing process. It's supposed to be a temporary, helpful thing. But here's the million-dollar question. What happens when that alarm bell just never shuts off? That's pretty much what happens in chronic inflammatory conditions. It's like your immune system's security guard gets totally confused. Instead of just fighting off bad guys from the outside, it accidentally starts attacking your own healthy cells and tissues. And that causes inflammation that just sticks around. So where does this friendly fire from our own immune system usually show up? Well, it turns out it tends to concentrate in three main zones of the body. Let's take a look at what those are. Okay, so we can basically group these conditions into three big buckets. First, you've got the dermatologic category. That's everything affecting the skin. Then there's rheumatologic, which targets your joints and connective tissues. And finally, gastrointestinal, which, you guessed it, involves the digestive system. Even though they all look different, they share that same root problem, misplaced inflammation. So, let's start with the skin. You've got conditions like psoriasis, where skin cells just go into overdrive and build up way too fast, creating those thick, scaly patches. Then there's atopic dermatitis, which most of us know as eczema, that dry, inflamed skin with that crazy, intense itch. And another one is hidradenitis suppurativa, or HS, which causes these really painful lumps deep under the skin, usually where skin rubs together, like in the armpit. And here's something that might really surprise you, how connected all of this is. Get this, about 30% of people who have psoriasis on their skin will also end up developing psoriatic arthritis in their joints. It's a huge reminder that what's happening on the surface can be a major clue about what's going on deeper inside. Okay, so moving on to the joints, you've got things like rheumatoid arthritis, or RA. That's when the immune system attacks the lining of your joints, causing a lot of pain and swelling. And a classic sign is that it's often symmetrical, hitting both knees or both wrists at the same time. Then in the digestive system, you have inflammatory bowel disease, IBD, which includes things like Crohn's disease and ulcerative colitis, which create all this chronic inflammation and damage in the gut. Okay, so with all these symptoms that can kind of overlap, you're probably wondering, how on earth do doctors figure this all out? It might feel like a long road, but it's actually a pretty methodical investigation. Kind of like detective work. Well, it all starts with the most important tools a doctor has, just talking to you about your history and doing a physical exam. Then come the blood tests. This is where they look for clues, like general signs of inflammation or those very specific antibodies that can point to an autoimmune problem. If they need a better look, imaging, like X-rays or MRIs, lets them see what's happening inside. And finally, a more specialized test, like a little skin biopsy or a colonoscopy, can often give that final, definitive answer. So once you have that diagnosis, the conversation shifts to management. And the good news is, the treatment toolkit we have today is, wow, it's way more advanced and targeted than it's ever been. One of the biggest game changers in treatment has been this move from broad to super targeted therapies. Think of the older meds, like corticosteroids, as a shotgun. They basically blast the entire immune system to calm things down. But the newer drugs, called biologics, they're like a scalpel. Incredibly precise. They're designed to go after the very specific proteins that are causing the problem in the first place. So what makes these biologics so darn effective? It's that specialization. They're actually made from living cells, and their whole job is to find and block these specific signals that are causing all that unnecessary inflammation. This means the rest of your immune system can get back to doing its normal, important job of protecting you. Now, because these are powerful, specialized medications that tweak your immune system, safety is absolutely number one. So before you even start, your doctor is going to run a few essential checks. They'll look for any underlying infections like TB or hepatitis, and they'll want to make sure your vaccinations are all up to date because there are certain vaccines you'll need to avoid while on the treatment.
But listen, medication is only one piece of the puzzle. The final, and maybe most empowering piece, is all about what you can do every single day to manage your condition and live a really full, active life.
And this is really where you get to be in the driver's seat. It's amazing how simple lifestyle changes can make a massive difference. Quitting smoking, for example, can have a huge impact. Regular, gentle exercise and maintaining a healthy weight takes so much pressure off your joints. And you should never, ever underestimate the power of managing your stress and getting a good night's sleep. Both of those have a direct line to how you feel. Being an active partner in your own treatment is probably the most important thing for getting the best results. That means, first and foremost, taking your medication exactly how it's prescribed. Please never stop on your own. If you're doing injections, it's really important to rotate the spots to keep your skin healthy. And always, always remember that big rule about avoiding live vaccines, like the ones for measles or shingles, while you're on a biologic. At the end of the day, knowledge really is power. Just understanding what's going on inside your own body, that's the huge first step to taking back control of your health. So the only question left to ask is, what's your next step going to be?